Good afternoon, everyone. Welcome. Lori Benalis, and I'm the Executive Director at Alta California Regional Center. And we're pleased to do the kickoff of our Board of Directors meeting for November 16th, 2023, with a public presentation of the National Core Indicators data. And we have a panel of individuals that are going to present, and I'm going to kick it over to Jennifer Bloom, who is our Director of Client Services, to introduce the folks that are on the presentation. Thank you, Lori.
Could I interrupt with some logistics first as far as the availability of translation and interpretation services? And if I could ask Giovanna to begin by providing instruction to anyone who's joined us who's interested in Spanish language audio to provide instructions.
Yes. Good afternoon, everyone. In order to provide language access, this meeting will have simultaneous interpretation from English to Spanish. Please note that the translation globe will not appear until after I've read through all language instructions. If you are bilingual, you do not have to click anything. If you're not bilingual, you will have to select the language that you speak in order to hear the interpretation. If you're on a laptop or a desktop, you will see a globe at the bottom right of your screen. Please click on the globe icon that says interpretation and select English. If you're on an iPad or a similar device, locate the three-dot menu on the upper right and select language interpretation and then English. When it's your turn to speak, please remember to be loud and clear and speak at a moderate pace, as the interpreter will be interpreting simultaneously into the other language. Buenas tardes a todos. Esta reunión contará con interpretación simultánea bidireccional del inglés al español. El globo de traducción no va a aparecer hasta que se hayan leído todas las instrucciones en los dos idiomas. Si usted es bilingüe, no tiene que presionar nada. Si usted no es bilingüe, tendrá que elegir su idioma para escuchar la interpretación. Si está usando una computadora, verá un icono en la parte inferior de su pantalla a la derecha en forma de globo que dice interpretación. Haga clic ahí y seleccione español. Si está utilizando un iPad o teléfono, localice el menú de 3 puntos que aparece arriba a la derecha. Haga clic en interpretación de idiomas y elija español. Cuando sea su turno de hablar, por favor recuerde hablar con voz fuerte y clara y a un paso moderado, ya que la intérprete estará interpretando simultáneamente al otro idioma. Gracias. Thank you.
I know, she should be freaking slowing down instead of running around like a...
Right. Thank you. And then if we could also ask and remind people speaking in English to speak slowly and clearly for the benefit of our ASL interpreters so they can help translate to ASL. And those online, if you could please mute your microphones to eliminate any background distraction noise unless you're interested in being recognized and speaking. Thank you.
Okay, thank you, Herman. My name is Jennifer Bloom, one of the Directors of Client Services here at Alta California Regional Center. We're here to present information on the National Core Indicators Survey. And before we get started, I just want to introduce our presentation team. And I will start with Herman here to my right.
Thank you, Jennifer. My name is Herman Kothe. I'm the Training Manager at Alta California Regional Center.
Hi, my name is George Lewis. I work for the State Council on Developmental Disabilities. We administer the National Core Indicators Project.
Hello, I'm Elijah Jenkins. I am the data scientist and system operator for Alta California Regional Center.
Thank you. So today we want to make sure that you all have an opportunity to provide feedback and input regarding the survey results that you're going to hear today. I'm going to give some information about how to do that in a couple minutes. And we just really want everyone to know that your feedback and your input is important to us. And it's really critical in how we move forward in our planning for the next year. Next slide. Thank you, Elijah. There we go. Okay, there's a lot of information on this slide. I'll go ahead and summarize. The National Core Indicator Survey is known as NCI, and it is a nationally validated assessment tool used by 48 out of the 50 states. And it's used to measure and track performance. In California, the Department of Developmental Services, or the DDS, contracts with the State Council on Developmental Disabilities to administer the survey. Alta California Regional Center has been working closely with the State Council, and we're proud to have George Lewis here to help present with us today. The purpose of the survey is to provide opportunities for clients and families to give feedback about the services that they receive. It's important to know that these surveys are voluntary and confidential. We know that about 414 of our clients and individuals who receive services have participated in this survey. Sometimes service coordinators receive questions from clients and families asking, what is this survey about? What is it for? Why am I getting this survey? And we always explain to them about the importance of the survey and encourage them to participate. So the survey responses really help us learn about areas where we're performing well. We need to advance. And areas where we can improve. And as I said earlier, your input is critical. On the slide, you will see some information where we have a NCI feedback email. You can share comments to the email address, and you can also put your comments in the chat. Please don't hesitate to provide any feedback that you're thinking of as we move through the presentation. Welfare and Institutions Code requires regional centers to present data annually in a public meeting. Today, we will be presenting data that was collected in fiscal year 21-22 and compare that data to the previous fiscal year in 2021. We're going to be submitting a report to the Department of Developmental Services on December 16th about our plans to address priorities to improve our performance. And although we accept feedback year-round, we really are hoping to have your feedback by December 1st to allow us time to compile the feedback and include it in our report to the department. Also, I want to point out that on the right panel of this slide, there is a link to the NCI data, and all of this data is also posted on our website. Next slide, please. So today we're going to review the results from the 3 surveys conducted in fiscal year 21-22. We have first the adult family survey, and this is a survey completed by families of an adult age 18 and over who lives with them and who receives 1 service from a regional center in addition to case management. The second survey is the child family survey, completed by families of a child ages 3 to 17 living with the family and receiving at least 1 service in addition to case management. And then finally, the family guardian survey. And this survey is completed by families and conservators of individuals 18 and over who live in a community placement setting and receive at least 1 service or regional center. Our historical trends are important and really help us determine how we want to move forward.
All right, well, that was a great explanation. All right, can everybody hear me okay? All right, again, my name is George Lewis and I work for the State Council. We do have a contract with DDS to administer this project. So just really quickly wanted to go over the review of the survey cycles. So as Jennifer mentioned, in 2020-21, we did what's called the in-person cycle. This is where we went out and we met with individuals either in person or mostly on Zoom because we were in the pandemic during that time, and conducted the surveys. And then the following year, 21-22, we went into what's our mailing. So we do that survey by mailing to the 3 different survey participants that Jennifer mentioned, the adult family survey, we refer to that as AFS, or the child family survey, CFS, or the family guardian survey. We run those 3 surveys consecutively in the same year. And in 22-23, we were back into the in-person survey, which again was a hybrid. And let me back up a little bit. All of our 2021s were on Zoom. None of those were done in person because we were in the pandemic. In 2023, we did go back to in person, which was really exciting. It was so nice to be out and see people in person again. But we had a hybrid of that as well too. Thinking that might be the same this next coming year as well too. So that was 2022, 23 was the in-person. Well, going back into 23, 24, we are back to the family survey that's going to be mailed, the adult family survey, the family guardian survey, and the child family survey. And again, all three of these surveys will run consecutively. As I've been coming to meet with you all, I've been kind of giving you some updates. Again, looking like January as a start for that. And then in 24, 25, we will be back to the in-person. And again, 25, 26, we go back to the mailing of the surveys. So all of those survey results, as Jennifer has mentioned, are always available to you guys on the DBS website. As we get them, it takes a little while to compile everything, but you guys can always find them there.
All right, so what does that mean for today's meeting in terms of reviewing the data that's available to us? And as Jennifer described, looking at areas where regional centers did well or Alta did well, and areas where Alta recognizes opportunities for improvement. There's a lot of data available to us, again, available and posted on our website. But those three surveys that were conducted to the three different target population groups had about 50 to 60 questions each. So you've got about 150, 170 questions with responses, which are data that can tell us important information about individuals' lives and trends and averages. We would be here for hours if we went through each of those. So the way we formatted our presentation was identifying areas where Alta stood out compared to partner regional centers, either stood out as a 5% response rate above average or falling 5% below. And each of the surveys, so that we aren't neglecting anything and giving you an overview of what the information that was gathered looks like, covered 6 different major areas of a person's life: their access, their choice, community participation, health and safety, information and planning, and satisfaction. So we provided a brief description of what each of those categories looks like in terms of the types of questions that were asked in each of the surveys. But you can sort of get a sense that if we're asking or describing what clients' access is, we're looking at their ability to connect with others, access their community. When it comes to choice, are choices being respected and honored? Community participation, are clients able to do the things they want, form relationships with others? Health and safety, there were about 17 to 18 questions looking at access to medical care, including mental health, dental services, etc. Information and planning looked at, are individuals being provided with the resources they need to make informed decisions, and are there areas where they'd like more information provided? And then satisfaction just looks at an overall appreciation or benefit and value to the services provided. The way the keys are established, I think it's pretty intuitive, but just for an explanation, we have color-coded boxes for each of the questions. Green box would indicate that Alta had response rates at 5% above or viewed in a positive comparison of other regional centers. A gray box would mean sort of that Goldilocks of right in the middle, not too hot, not too cold, performing similar to other regional centers. And a red box would indicate that Alta response rates for surveys were 5% below the average. And those are areas we want to look at opportunities for.
All right, so the first survey that we're going to look at is the adult family survey. First, the demographic overview. The average age is 34. The most commonly occurring captured diagnosis was intellectual disability at 70%. Second most common occurring diagnosis was autism at 38%. Preferred languages in order of occurrence are English at 89% and Spanish at 3%. We also opt to include some other key statistics to compare across groups. So household income, the most commonly occurring is over $75,000 net per annually at 24%, and then 25 to 50K net at 18%. And the sample size for Alta California Regional Center is 384 respondents. Alta California Regional Center had a slight positive skew, meaning a positive connotation above the 5% threshold set by the Department of Developmental Services and the Fed in the areas of access, health, information and planning, and ever so slightly in satisfaction, and a negative skew, meaning a negative connotation below the 5% threshold in access and satisfaction. First questions we're going to examine for this survey specifically are access, and what we tried to do was balance the positive connotation with the negative connotation to give a more full picture. So first question, are you or your family member able to contact the case manager or service coordinator when you want? At Alta California Regional Center, 54% replied always, in comparison to 48%, which was the state average, which was a drop from the year previous of a state average of 52%. Now we compare that with if your support workers and or service coordinator do not speak to you in your preferred language, is a translator provided when needed? Alta California Regional Center averaged 22% of the always answer in comparison to 31% of the state average. Have additional comments? The next area we're going to examine for this survey was community participation. For community participation, we focused on the question, does your family member do things in the community? For Alta California Regional Center, the average was 77% responding yes, in comparison to 74% of the state average, which was a drop, and we're likely attributing that drop to COVID and the pandemic and lockdown therein. But what we also tried to do in this area was examine the barriers. So to the right is a breakdown of the barriers. The barriers word should be noted multiple choice, so each respondent could choose more than one. The highest two occurring barriers almost equally were cost and stigma, but roughly 34% replied with no barrier. I think that's just interesting, worth noting. Herman?
So, again, identifying areas where Alta might improve, and also keeping in mind that this data is a look in the rearview mirror. It's years past, so there may be things that we're actually already doing, implementing, that could have positive impact on that. And one that we like to point out and reinforce and spotlight is the restoration of social recreation services to the regional center system. So with Alta's ability now restored to support clients with accessing that, those are discussions that are happening or could or should be happening at every planning team meeting, exploring what clients' interests are and increasing community access.
All right, the next survey that we're going to look at is the child family survey. So again, to review the demographic average statistics, the average age for the client in question was 9. The most commonly occurring diagnosis was autism, 78%. The second most common occurring diagnosis being intellectual disability, 31%. Preferred language in order of preference was, or in order of choice was 80% English, 5% Spanish. Household income in order of most commonly occurring was over 75,000 net annually at 33%, with between 50 and 75,000 at 18%. The sample size for Alta California Regional is 232 responses. There was a slight positive skew in the areas of access, health, and information planning, and a slight negative skew in access and information planning, with the overwhelming being within the area of average.
Hello. Hello, this is the interpreter. I'm hearing a lot of shuffling, which is preventing me from hearing the speaker. It sounds like paper or something.
That might be my paper, I apologize.
Thank you.
So
Then that's what it was. It was just
I'll try to hold my paper farther away from me. So the two questions that we're examining for, or the first question that we're examining and the area that we're examining for the Child Family Survey is health. So the first question, can your child get mental or behavioral health supports when needed? 30% of Alta California Regional Center respondents replied always, in comparison to 27% replying always for California state average. Should be noted that there is no previous statistics because this question was not available for previous years. So in those instances, obviously we did not include it. In comparison, the question, can your child see a primary care provider, meaning doctor, registered nurse, etc., when needed? For Alta California Regional Center, 77% of the respondents replied always, in comparison to 72% of the California state average, which also represents an upward trend overall, both for Alta California Regional Center and the state.
Thank you, Elijah. We attribute the positive results in this measure partly to the relationships that we have with our managed Medi-Cal plans. We meet quarterly with managed Medi-Cal plan liaisons within each plan, and we reach out to each other as necessary. And I think that an understanding of our systems and our processes really benefits our shared clients and patients. Additionally, we pride ourselves on having partnerships within the community, specifically with the UC Davis Mind Institute, UC Davis Health, Sutter Health, and others. Our partnerships with county child welfare agencies and school districts also allows for a lot of collaboration and identification of service gaps and needs for the children that we serve. For example, our partnership with child welfare has helped dually served children receive the services they need. And recently, we were approached by child welfare for support in determining eligibility, regional center eligibility for a young child. This was a complex situation involving multiple systems to include child welfare and mental health. And during the eligibility process, ACRC was invited to participate in planning team meetings to help connect the child and the foster parent to resources even before they were determined eligible. The child was determined eligible for regional center services, and we've already established a positive working relationship and trust amongst the team. So we also want to point out that this example really ties into our strategic plan and our focus area under the category of child and family support. Within this focus area, some of those goals include helping to facilitate the identification of community resources and to conduct informational presentations with our provider networks. We also have a vendor provider called Level Up NorCal, who specializes in assisting families who experience cultural and linguistic barriers in accessing services and navigating services. And these initiatives really help improve awareness and access.
Right, the next pairing that we are going to examine are questions in relation to public or generic services as compared to planning for your child's future. We tried to pair these questions in an interesting way to draw as close to a causal relationship as might be possible. So for the first question, do you have enough information about other public services your family can get, food stamps, Social Security income, housing subsidies, etc.? ACRC, we compared two values, average 22% replying always and 22% replying usually, in comparison to 18% at the California state average, replying always, and 19% replying usually. There's some interesting comparisons when you look at this in lieu of the question, do you need help planning for your child's future in any of the following areas? Again, this is a multiple choice categorical question with the respondents replying that recreation, social relationships, and financial were the top three. So this is sort of a recognition that while we are a system of care. We are not the only system of care. And we also have a duty to help people stay informed of other generic services to live a well-rounded life.
All right. So with regard to access, and that was a recurring theme throughout all three surveys, access, providing information in language that people understand, accessible information. And again, there are a number of initiatives that have already been launched to address some of these. So in terms of planning for the future, it's continuing what we're doing in hopes that the new survey results will reflect improved access. But regional center system was provided through the legislature, funding through a language access cultural competency budget to the tune of $16 million. Alta California Regional Center was given $1.1 million in language access cultural competence funding. And how Alta allocated those funds, spent those monies, and continues to plan to spend those monies is through providing bilingual pay stipends to staff who speak language other than English, translation of critical regional center informational materials to share both hard copy and electronically on our website, to host a number of listening sessions to hear from communities what their areas of identified needs are and suggested areas for improvement. Internally, which didn't cost a penny to the regional center, was the establishment of a diversity outreach work group that meets monthly. And we give credit to Lori Benalis, our executive director, for coming up with the idea to draw on the expertise of our staff as a resource. So identifying communities and opportunities to engage with community partners for outreach events. Those are continually posted on our website. And then we have our continued service access and equity grant projects that Alta, along with community partners, put forth for the department to approve. And this year, Alta is working with La Familia Counseling Center and Haiku, Hmong Youth Parents United, to hire intake navigators. And intake navigators are individuals who speak the language and are culturally competent in the Hmong community, Spanish-speaking communities, to assist people navigating our intake and eligibility process, which, as Jennifer mentioned, when individuals are exploring regional center services and aren't yet linked with us, we have limitations in the availability of support to those folks. So these positions will help members of diverse communities navigate that system. And we also have purchased iPads that are stationed at our reception desk, so people that arrive in the lobby in person who speak languages other than English can speak their native preferred language and have that translated in real time to the receptionist, who can assist directing them where they need to go.
And a little more about information and planning. We're really fortunate to have several specialist positions on our team who can provide additional supports to the clients and families we serve. These also help support our strategic focus area under client and family support. And some of these positions include our IDEA specialist, Individuals with Disabilities Education Act specialist. Let's see, our dental coordinator, housing specialist, our data scientist, our cultural specialist, client employment specialist, deaf and hard of hearing specialist, health and safety waiver specialist, and a community services and support specialist who's dedicated to social recreation activities. So these employees really help support our clients and our families in just planning for services and navigating the various systems that we do. Our team is proud that we have a health and safety waiver in place for an adult client who is deaf and who is fluent in American Sign Language. Our client is also losing her vision and she's experiencing mental health challenges. So you can imagine that it's been difficult to secure the right services for her at the right time. We explored many supportive services for her. She lives independently, and she needs more help as she's losing her skills, her independence due to her declining vision. So the health and safety waiver that we received has allowed her provider to hire a support person who is also fluent in ASL to support her during her daytime hours. And this has been very positive for her, really enhancing the quality of her life.
The overview of the summary statistics for the third survey, the Family Guardian Survey, are as follows. The demographic statistics are average age, 44, most commonly occurring diagnosis is intellectual disability at 68%, followed by autism spectrum disorder at 35%. Preferred language is English at 96%, followed by ASL at 2%. The average household income most commonly occurring is over 75,000 at 28%. With 50 to 75,000 at 15%. Sample size was 331 respondents. Additionally, we opted to include that 45% of the respondents replied that they have no guardian or unconserved. 49% of the respondents were limited or full guardians. The skew was as followed. There was a slight positive skew in community participation, health, and information planning, with a slight negative skew in access, health, and information planning as well, but the bulk of them being within the 5% central tendency. So the two questions that we're comparing side by side here cover two different areas: satisfaction and access, which we think there's typically a common linkage between those. So first, overall, are you satisfied with the services and supports your family member currently receives? Refer to the pie graphs on the far left. 83% of the respondents in the Alta California Regional Center survey replied either always or usually. And we compared that to the grouping similarly from the 2019, 2020, and 21-22 surveys, where the average for the 21-22 surveys was 85%. So within that 5% was slightly below. Now, comparing that to something that may very well affect satisfaction, do your family members' support workers change too often? Is there too much quote unquote turnover of support workers? 35% of the Alta California Regional Center respondents replied that yes, there was too much turnover compared to 27% of the state average. It is worth noting that it was difficult to parse what the term support workers meant, but we felt that fell within the purview of our mission statement.
So efforts to address turnover, which would be the converse, retention, and we like to point to efforts to continue to recruit, to fill vacancies, to manage workload, to make it equitable and fair and manageable. We do have an employee recruitment incentive whereby existing employees who help us find compassionate individuals to work for Alta receive a $250 stipend for the initial referral. And if the person they refer stays with us through their introductory period, they get an additional $500. We just brought on 6 new mid-month new hires, and we added mid-month new hire sessions so that people don't have to wait an entire month if they're interested in coming to work for Alta. We continue to draw in high quality, high caliber staff and create a team environment in hopes that they'll want to continue to stay and fulfill the mission and vision of Alta. Additionally, with regard to direct support professionals who are also critically important to the satisfaction of our clients, we've partnered with Valley Mountain Regional Center to create a DSP hiring initiative and supporting our vendor providers and locating staff who have interest in coming to work in that field.
Crisis averted. So continuing with the final survey, we wanted to highlight an interesting question about choice. Does the agency providing residential services to your family member involve them in important decisions? We chose to highlight this also to sort of to make sure we covered all the areas of concern, but also to illustrate sort of some of the methodology and thinking behind the way that we parse data. So when initially looking at this question, if we're just looking at always or usually, the combinatory stats are 60% of Alta California Regional Center clients said yes, or always or usually they are provided, the agency providing residential services involve them in important decision compared to 58%. But we noticed that there's an NA section, which by implication likely means that they're not receiving this service. So we cleaned the data controlling for that option, which actually took the combinatory statistics to 74%, replying always or usually that they are involved in important decisions compared to 71% of the state average.
Are we advancing slides? Oh. With the passage of AB 1663, the law supporting supported decision-making as the least restrictive option to conservatorship, Alta has been meeting with a work group of clients from our Client Advisory Committee, representatives from State Council on Developmental Disabilities, and Alta client advocates to discuss resources to develop training material for staff and the community. Supported decision-making is a process that allows people with disabilities to receive support from individuals they choose to help them make life decisions. This is a new area for clients to exercise choice in decision-making. Alta's work group has been meeting monthly since May of 2023. That's relevant because some of the survey respondents are adults and family members are responding about their involvement in decision-making, legally responsible adults. There's statistics included in the survey sample as to the number of clients in the survey who were conserved. I think because it's a nationwide survey, they use the term guardianship, but I think we recognize it as conservatorship. But recognizing that Alta, as well as conservators, have an obligation to promote the greatest degree of independence and choice and autonomy of our clients. Supported decision-making is a new tool, a new mechanism that allows for there to be input, which Alta always values the input of involved family members to the extent that the adult client allows. And supported decision-making will be another tool. Because California receives funding from the federal Medicaid program, the new home and community-based service waiver rules that went into effect March of this year, we are required to have our providers comply with those new federal rules that really push and emphasize choice and autonomy of the individual. Some examples of those rules in different service settings are the right to have a lock on one's door in a community care facility, and the option to live by yourself rather than with a roommate if you're currently in a two-bedroom care home setting. So those were some major changes handed down from the feds that the state and regional centers will need to comply with, and we want to comply with, because they support and promote greater choice in client services.
All right, the final statistics that we're going to examine are the overall summary statistics. And we thought this was important to compile because it is in essence all the statistics combined in one place representing a global picture of the respondents from the Alta California Regional Center. Alta California Regional Center had a pretty marked positive skew in the areas of health and information planning, some of which we've addressed today, and it's continued support through initiatives with a slight skew in the positive for satisfaction, community participation and access. There's some negative skew in access and slight skew and negative skew in information planning and satisfaction. Overall, of all the questions compiled, 43 of the 195 questions, or 22.05%, had positive connotation above the 5% threshold. 70.25%, or 137 of the 195 questions were in the neutral range, neither 5% above or below the state average. And 15 of the 195, or 7.69, were in the negative range. Below, you'll see that Alta California Regional Center, when compared at average or above average, 92.3% of the respondents replied in the average or above average, and 7.69 replied below average. Thank you for your attention. I'd like to thank again Jennifer Bloom, Director of Client Services, Herman Covey, Training Manager, and last but not least, George's name is supposed to be in there, why it's not. George Lewis from State Council.
Undeniably present.
I'm Elijah Jenkins, data scientist for Alta California Regional Center. Thank you for your attention. There he is. See, I knew I put it in there. I just didn't add the effects.
Dramatic.
Yes, yes. Nice, Elijah.
Thank you for presenting. It's a lot of data points, as you indicated, and it's a lot to try and wrap your arms around and present in a public way. We are, as Jennifer had indicated, very interested in receiving feedback and know that there have been messages in chat, which we're capturing, but we also want to continue to underscore and push you to our email address, which is again, NCI
feedback
at altaregional.org. Please continue to share your thoughts. We're really interested in continuing to do well in the areas that we had marked progress in that area, and in those areas, the green boxes. Also, just to note, all of those boxes that were present in the slides indicate individual questions, and I'm not sure that was understood completely. And so I do want you to know that they're not just up there as like a scatter. They actually represent each individual question, and that's what the response noted. But we are interested in the red areas, in ways in which we can continue to improve so that services and the delivery of services and support are meeting the needs of those that we are here to serve. So if you could do some deep diving into areas that could help us with some feedback that could suggest new ways of looking at things and doing things, initiatives that we might not have been considering, or ways of doing things differently, that would be helpful. And we thank you for your time.
Come back for training.
All right, so our board chair is asking for a 5-minute break, and then when we come back together at 10 minutes to 5, we will continue with a board training on the overview of our legal department and some statistics, and then we'll get into our board meeting.
Zoom call is pretty late.
Tom, you're good.
I'm late. I was both there. My apologies.
Thank you.
Okay.